sound. Put up the sound. Who is playing something? Don't put it up. Hi everyone, welcome to ATP Live. Apologies for starting a little bit late. Okay. Just give me a few minutes. I was practically rushing in to come and do the ATP Live. All right, but I'm glad I'm here now. Good evening, everyone. Welcome to ATP Live Monday. This is a platform where you get to ask all your questions and get answers immediately. I am Dr. Gbemisola Boyede, and I'm a pediatrician. And so if you have any questions about your child health issues, feel free to drop them in the comment section and I will be able to answer them. Just a minute. I think something is missing here. Okay, I got my ATP Live on now. Better. Okay, so welcome to ATP Live. Feel free to drop your questions. If you're watching me on Instagram, feel free to drop your questions. If you're watching me on Ask the Pediatricians Facebook group, you can drop your questions straight onto the page, under the video. But if you're watching on ATP Family or ATP Selling Mom, you need to navigate your way to the post itself to drop your questions. So welcome everyone. I can see some of you already. I'm just going to spend some time to quickly share the video. Please also share the video, and then so that many more people can watch and ask the questions live. Thank you. So you're welcome. You're welcome. Please share the video, invite friends and family, and we can all watch together. I'm just trying to share, making sure I share to all the various places that I should be showing. Okay, we're going to start in a few minutes. I just want to make sure that the videos are properly pinned to the right. I think I'm going solo today. I'm not sure I have anybody joining me. Just 1 more minute and I'll be with you. Just want to make sure that all the videos are live. Oh, find my video. Okay, for those who are on ATP, I can't seem to find the video, so please kindly ensure you, if any of our moderator is watching, please can you ensure you pin the video to the feature section. Oh no, I've seen it now. Okay, all right, I can do that myself. Thank you. Okay, so I think we are all okay and good to go. All right, so let's start. Again, as we're starting, please, if you're asking questions so that we don't waste so much time, make sure you put the age of your child in every question you're asking. Please make sure if you are asking about the weight of your child is losing weight, please put the weight, the birth weight, the current weight. It make more sense. There's no way we will know whether we should worry about the weight of your child or not if there are no objective information. And try and keep your questions straight to the point. Don't tell us the entire life history of the child, just essential information needed to answer the question so that we don't waste so much time, and keep it short and simple, straight to the point, so that it doesn't block the entire page when your question is posted. All right, so thank you so much. I think I can now start. If you are on our Ask the Pediatricians Facebook group, if you don't give StreamYard the permission, I will not see your name. So which means if you give additional information, I won't know who was it, whether you were the old or the new. So it's better you give StreamYard the permission, but it's also okay if you don't want to do that. But try and make sure that all your information is in one post. Don't break them into pieces, because I will not be able to see that. All right. So the first question I've got now is, my 1-year-old is just 8 kilos, birth weight is 3 kilos. She's able to sit and not walking yet. So this person wants to know, I guess you want to know, please also ask questions. Don't just tell me information and don't ask questions, because I'm not going to assume what your questions are. So like this first person, you've not asked any question. You are just giving me information, which is fine, but there's nothing I'm going to do with that information. So, but I'm assuming, and this is the only assumption I'm going to make today. Every other person, please put a question in your post. Don't just leave information without asking a question. We cannot read your mind, so I won't know whether you're worried about the weight or whether you're worried about the not walking, or whether you want to ask me what you want to do. So it is very important that you actually ask questions and not just leaving only the information. So if you are worried about the weight is not so bad. It's just the lowest limit of the normal. Usually we want your baby at 1 year to be weighing 10 kg, but 8 kg is still within normal. But anything less than 8 kg will be underweight malnutrition. So please try and make sure you're feeding your baby properly. You may want to go through our post on complementary feeding to make sure your child is eating adequate quantity and quality and right frequency of complementary food. And I hope you're still breastfeeding. And as regards the not walking, it's okay if your baby is not walking at 1 year. We are not worried. Some children will not walk at 1 year. Most children walk at 1 year, but some will not walk at 1 year. But if your baby is not walking by 18 months, that is when you should see a pediatrician. You didn't tell her whether your baby is crawling, whether your baby is moving. So if your 1-year-old is crawling, I will not worry. But if your 1-year-old is not crawling or not bump shuffling, then I will worry more, because that is a milestone that should be achieved before standing and before walking. So if the milestone preceding that is not yet achieved, then I will worry. So if your baby is not yet crawling or moving in any way, please see a pediatrician. If your baby is already crawling, moving, or even trying to stand, like your baby will stand holding a table and move around the table, then that is fine. So it's just a matter of another few months and your baby should be able to start walking. So we will not worry about that. So I hope that helps, and I hope that helps for those who may have those kind of questions. So if your question has been answered in another person's question, there's no need to repeat it. Just take the same answer. All right. Okay. Thank you, Lawal Omobolanle. what could I use for my baby rashes? So this kind of question is what we call generic questions. There are different kind of rashes, and different kind of rashes require different kind of treatment. So you need to be very specific about rashes for us to know what we don't just recommend. Use this, use that for rashes. We have not seen the rashes. We don't know what is causing the rashes. People that give you those kind of recommendation, that's not good. It is not right. It's not appropriate. So nobody should, you can't just say my baby have rashes and somebody just say go and use that. That doesn't make any sense, because there are different kind of rashes. There are rashes that don't require any treatment. There are rashes that all you need to do is to stop. For example, if your child is reacting to something, so you can't just say, what can I use for my rashes, and expect that you're going to get a miracle drug. And despite all the adverts and everything people tell you, there's no one cream or product that once you use it, all rashes will go away. That is actually misinformation. Please don't believe them. They just adverts alone. So a good doctor needs to see the rashes, needs to figure out what type of rashes, we need to figure out what is causing the rashes, and then the doctor will be able to tell you, based on the cause of these rashes, this is the treatment. Sometimes you don't need to use anything. Sometimes you just need to stop doing something or start doing something. So what I'll recommend for you is that you may want to post a picture of the rashes and give additional information, like what is the age of your child, how did the rashes start, how long has the rashes been there, which part of the body is affected. Those are the information doctors are going to ask you to know what is causing the rashes, to be able to give you solution. But if the rashes is in the nappy area and all that, please don't post pictures of genitals or private parts on our Facebook group or any of our accounts, because that is not acceptable. In that situation, you need to really see a doctor physically who can examine your child and recommend appropriate solution. So I hope I definitely answer a lot more about rashes, because many people ask this kind of question about rashes and expecting a miraculous prescription. You're not going to get it. You will need to see a rash. We need to make a diagnosis of the rash, and then that is when we can now tell you what to do about the rashes. But what I normally recommend is go through our Facebook group or our website and read about what is the basic care of a baby. Sometimes some of these rashes are due to our own not properly doing the right thing when it comes to the care of your baby, in terms of the product you're using on the skin, in terms of other things you are adding to the cream, or the kind of product. Maybe your child is allergic to them. Babies have sensitive skin. So you need to first make sure you are not doing the wrong thing, you are doing all the right things, and then you cannot get solution to the rashes if they persist. All right. So thank you for joining us. If you have a question, just drop your question and we're going to answer them. All right. Thank you so much. All right. Okay, so this person is asking the same question. What would I use for rashes? Your question is not specific enough. You need, I think I've told you what to do now. Okay, so Gunda Ray Damilola is asking, good evening, thank you for all you do. Thank you. I have a niece who is 12 years old and still bedwet. What can be done? The mom is worried. Yes. So any child who is above 5 years old who is bedwetting needs to see a doctor, because people used to think bedwetting is just a habit or a child who is not doing the right thing, but there are some medical conditions or medical issues that can be associated. That in other words, bedwetting can be beyond the control of that child. Usually, this child should have seen a pediatrician at the age of 5 years. So, if your child is below the age of 5 and they are still bedwetting, we don't do anything about it, because there's what we call the bladder and all those, the pathway where urine comes from needs to be mature. The child needs to be conscious of the fact that the bladder is full. They need to get up, and go to the toilet and to wee and all that. So, but usually after the age of 5, if a child is bedwetting, you need to see a pediatrician. So we want to check, is it that the child is sleeping too deep or are not able to wake up? So we use something like bedwetting alarms, things that will wake up the child, or is it that the child is making so much urine? And when the child makes so much urine, the urine spill over. So sometimes there are medication we can use to reduce the amount of urine the child makes at night. Also, sometimes before we even do that, we first talk to you about water. So children need to drink a lot of water during the daytime. So a child with bedwetting, you don't need to reduce their water intake. You need to actually increase their water intake during the daytime. I know it sounds contradictory, but we want them to actually wee more in the daytime. But once it's about around 6 p.m., max 7 p.m., you stop giving them water. So they should drink much water in the day, but not in the evening time. You also want to make sure you don't give them things that irritate the bladder. So this children should not be taking tea, taking soda drinks, taking all those kind of stuff. Those kind of things also irritate the bladder and can contribute to the bedwetting as well. And of course, you also need to we need to make sure there are no other problem with the kidneys or the urinary tract or the bladder, like urinary tract infection, even constipation. So the child needs to eat and drink a lot of water so that they can move their bowel, because the bladder and the bowel and the rectum where the feces are stored, they are just in front of each other. So if there's a lot of feces, it kind of pushes on the bladder, so there's not enough space for the bladder to store urine. So constipation has to be treated and has to be kind of sorted first before we can even start talking about urine. So these are things that your pediatricians are going to be sorting out and then monitoring your child, and it can be treated and children can overcome their ability. I mean, they can overcome bedwetting. So it's not for you to start beating the child. It's not for you to start screaming on them. It's not for you to start punishing them and or embarrassing them. It's about making sure that you give the child the right support. So a 12-year-old bedwetting, please see a pediatrician who knows how to manage bedwetting. If you're not sure, you may want to go to a teaching hospital. Many of them have what we call enuresis clinic. That is a clinic for children who are bedwetting, and they'll be able to provide you the right support. I hope that is helpful. Yeah, okay. All right, thank you. I'm coming to Instagram very soon. The next question, good evening, dog. My baby of 3 months, birth weight is 5.9. Birth weight of 5.9, that is really much. Are you sure it's not the current weight? Scratches her eyes often. Sometimes she wakes with pus on her eyes, which I usually clean with water. What could be the cause? So there are many reasons why your baby could be, scratching the eyes. The first thing is you have to make sure that there are no products that you're using that is sensitive to, that the child is sensitive to. If the child is allergic to a particular product, then the child will likely itch, and then they can itch the eyes as well. Some of you put so much oil on the baby's head and it's always dripping down the face into their eyes, and it's very, it will irritate them and cause them to scratch their eyes. So I always tell parents, please, only 1 drop of oil during the when you give them the morning bath, it's enough. You don't need to keep pouring oil all the time on the anterior fontanelle. It does not do anything to the anterior fontanelle. The anterior fontanelle does not require any oil per se. So please stop doing that. So you don't allow so many things dripping down the baby's face and causing rashes and all that. Then that is number one. So you need to make sure there's no skin rashes, there's no other thing irritating the child's eyes or skin, that will cause that. So there may be problem with the eyes itself. For example, if your child is having eye discharge, or the eyeball, that white part of the eyes is red, or the child is always bringing out water, then the child may have a problem with the eyes, what we call either a conjunctivitis or any of those infection within the eyes. And then for that, you really need to see a doctor. So, and the way is that if you clean the discharge in the morning, like most of us, when you wake up, you may have a little bit of discharge. There's absolutely nothing wrong with that. But when you clean your eyes, you have your bath throughout the day, you don't keep on having high discharge. But if your child keeps on having eye discharge throughout the day, in other words, when you're giving the morning bath, you've cleaned the eyes of and all that, but during the day the child's eyes still discharging and you need to clean it over and over again, then that means the child most likely have an infection involving the eyes, and that is the time to go to the hospital. Please don't put anything in the eyes. Don't put breast milk in the eyes. Don't put zero or what they call lead or all those eye pencil stuff. Please don't put this in the eyes of children, because most of them have lead and it can cause children to have lead poisoning. Lead poisoning can damage the brain of children. So these are some of the things parents do without knowing they are causing harm to their children. And breast milk is not eye drop. It is not treatment. It's not an antibiotic eye drop. Please don't put breast milk in your baby's eyes. If your baby is having high discharge or having high infection, please go to see a doctor and let the doctor treat the eyes. You don't want to cause damage to your baby's eyes and cause more problem for the child in the future. So that's very, very important. I hope that is helpful for the Facebook user. Okay, the next question is, what is the best calcium and iron drugs for a 1-year-old baby? A 1-year-old baby does not need to take any calcium drop, does not need to take any iron drop. A 1-year-old needs to eat food that will supply iron, that will supply calcium. The best food to supply calcium for children below the age of 5 is milk. And that is why all children should be taking milk. So a 1-year-old should still be breastfeeding. If you have stopped breastfeeding, you must give age-appropriate formula for a 1-year-old. All children below the age of 5 should be taking milk because that is the source of the calcium. They also get calcium from meat, from other food, dairy products and all that, also a good source of calcium. Iron is in meat, fish, all those kind of food. So what we want you to do for your children is not to be giving them drugs. I don't know why parents want to give drugs, even for multivitamins, they are very unnecessary. Give your children food, natural food that will supply those products, because all those drugs are never alone. When they say they're giving your child iron, they are adding other things to it to make it into a syrup. They are adding other things to it to make it look like that shape, what we call additives. And those additives, they are usually very small, but the more your children taking them, they are unnecessary products going into the bodies of the children. So please avoid drugs if you can. Honestly, we are happier if your children don't have to take any drugs at all. Why should your child take drugs for iron, for calcium? They have food. Let them eat proper food, and they will get all those things from the food, and it will be stored in their body. So don't get into the habit of, I should always be giving one drug or the other to my children. It is completely bad practice. Okay. Name, I hope I got your name, Precious. Saying good evening, doctor. Thank you. I observed Dead Sea. I don't know if it is wax in both of my babies' ears. Okay, usually wax will look like it looks usually brownish, very dark brownish and all that. And so you will see it's initial or yellowish. But if it is spots tend to look more like creamy, that kind of a thing. So when it comes to your children's hairs, please do not clean their hairs. Do not use anything in children's hairs. It's a very, very bad thing. I know most of you buy cotton buds, and your goal using cotton buds to clean the hairs. It's actually not meant for you to clean babies' hairs. The ENT, the ear, nose, and throat doctors say the hair is self-cleansing. In other words, those wax actually, they trap all the dead stuff in the hair, and they will now flow out. So when they flow out, just clean it. But please don't insert anything into the hair of the children. You can perforate their eardrum. You can cause deafness for them. Just leave it alone. If you think there's something in the hair of the children that is so thick, the wax is so thick or is so hard, it's not coming out, you can put olive oil. Just drop olive oil in the hairs. You can drop olive oil into the hair, 1 or 2 drops. You can do it at night. It will soften the wax, the hair wax, and it will flow out. When it flows out, you just clean it off. That's all you need to do. Please don't put anything in the children's hair. It's very dangerous. Some hair, if you put the olive oil and the wax is not coming out, please go to see the doctors. You can see the doctors, they know how to flush it out. So they call what we call ear syringing. They put some water in the hair and the wax will come out. That should be done by trained healthcare professionals in the hospital. But please do not put a cotton bud, all those rubbish. Don't put it in the hair of children, not even in a 2-month-old. Just leave the hair alone. The wax should flow out by itself. When it's out and you can see, you use your handkerchief, and just clean it out, or a soft clothes or soft face towel, something like that. Just clean it out, something soft, not something pointing, something that will perforate the hair. Don't put it in their hairs at all. I hope that is helpful. Okay, so this person is still asking, what can I do for 7 months old rashes? I think I've addressed the issue of why we cannot answer your question. You need to post the picture of the rash. You need to put it where we can see it. You need to tell us more information about the rashes for us. We can't obviously answer any question about rashes on this platform because I'm not going to be able to see a picture or anything. So you can either post it on our Facebook group or see a doctor who can look at the rashes. And please don't treat rashes when you don't know what it is, because most of you cause more problem by your treatment than even the rashes itself. So please be very, very careful. Okay, so this person say, I'm worried about the weight. I think I've answered your question, which is why you should always ask your question, because you post about weights and the walking, but you didn't ask any question. But luckily, I've answered both of them at the same time. Is it okay? Okay, Chijioke is asking, is it okay to use pacifier for my 7-week-old baby? Okay, so this is a very controversial question, but most of us pediatricians, we don't support the use of pacifiers. I know a lot of people also have reasons why they want to support it. Generally, we don't want to use pacifiers, and we have many reasons for them. One, when you use pacifier for your babies, you can create what we call nipple confusion. So the baby suck on the pacifier almost like another nipple, and then the baby may not want to suck on the mother's breast. So we don't even want a baby who is not yet established on breastfeeding to take pacifier, because you are going to create nipple confusion, and the baby will want to either suck pacifier but will not suck on the mother's breast. So please no. Two, they tend to drop a lot, drop on the floor, drop everywhere, and mothers just pick them up, just sit on their clothes, and just put it back in the child's mouth, introducing germs into the baby. So this is another reason why we don't want that. So generally, pediatricians like myself, we don't support the use of pacifiers at all. So I will say no to pacifiers, dummies, and then some babies become so attached to them, getting rid of them becomes another issue entirely. So it's better not to introduce it. Breastfeed your baby, find other things for the baby, no pacifiers. Okay, Ohajo Scholar. Okay, I'm going to go. After this, I go to Instagram. Thank you for all you do. What can I give to my 4-month-old baby for blocked nose? So if your baby's nose is blocked with what? Is it mucus? If it is mucus, then all you need to do is to put, like, we have what we call saline drops. Saline drop is normal saline. It's the same sort that you used to eat at home, that is dissolved in water, but of course prepare under more sterile condition. So you drop it in the nose and it will soften the mucus and the mucus will flow out. That is all you need to do. Please don't go and be buying what they call nasal drops, because many of you go to the hospital. I've seen a lot of mother posting pictures of steroids nasal drops, and they think that they are buying something for blocked nose. Those babies are not supposed to be using those kind of steroids. They are supposed to be prescription for very specific things. Usually, most time they are prescription for children who have allergies and all that, causing their allergic rhinitis. They are always having blocked nose. Usually, they are older children, not your newborn babies. For babies like that, please only use normal saline. If you go to the pharmacy shop, like some shops, especially in Nigeria, they just want to sell you their products, and they'll tell you, oh, just use this one. So it's the same thing. It's not the same thing. If it is not the same thing, it is. If it's not normal saline or saline drop, it is not normal saline drop. Don't take any other alternatives. All those Otrivine and so many other ones that they give you, they are not saline drops. They should not be used in babies. They are prescription only medication. You don't need prescription to buy saline drops. You can buy it by yourself, but please don't take any other alternatives by the people who want to sell products, because you're going to cause more problems and harm to the baby. So let me go to my Instagram. Instagram people, thank you for being patient with us. Okay, Demi D say, my 5 months baby is trying to stand. Please, do I stop him? Yes, you should. I usually, if I see a 5-month-old baby who is trying to stand, I want to examine that baby, because sometimes it may be a sign telling us something else. Especially if the baby is also very stiff. If the baby stand are stiff, the legs are stiff, that baby should see a pediatrician, because we do see some of those kind of situation. Of course, some people could be very fast. Some maybe work at 7 months and all that, but usually they have the exceptions, not the rule. So usually if a baby is trying to stand at 5 months, we want to examine that baby to make sure the baby is not having what we call hypertonia, and which is a sign that baby is very stiff, and it's always a sign of a something neurological, something wrong in the brain. So we always want to see that baby. So I would say maybe when you go for your immunization next, get the pediatrician to have a look. But if your baby is otherwise well and fine, baby is already sitting, baby is already crawling, and now wants to stand, then that's fine. But if your baby is not yet sitting, not yet crawling, and now wants to stand, it may be a sign that the child actually has a and health issues and should be seen by a pediatrician. Okay, so Shami for King, good evening, dog. How can a mother know when the baby is dehydrated? Okay, so number one, you don't want your baby to even be dehydrated. So, and what will make a baby dehydrated is baby is not getting fluids. So a child who is breastfeeding should be taking breast milk all the time. So they shouldn't be getting dehydrated. A child who is above 6 months can't drink water and they shouldn't be getting dehydrated. If they're having diarrhea, you should give them ORS, because the reason why I say that is because there's what we call mild dehydration, there's what we call moderate dehydration, there's what we call severe dehydration. Children can be dehydrated and you don't have any sign. We call it mild dehydration. So a child who is passing watery stool and all that may still be playing, may doing other things, but the child could be dehydrated. So this is why you make sure you're actually not allowing situation for dehydration to happen in the first place. But if a child, by the time you are seeing sign, the child is already becoming moderately to severely dehydrated, and we are worried at that point because children can easily lose all their body water so quickly, and it can be very dangerous. So, what are the signs? So, in the when they are going from mild to moderate, you begin to have the children being thirsty. For children who can talk, they will tell you they want to drink water. They are thirsty. Their lips will be dry, and all their eyes, they will not be making tears and all that. Then you know that this child is getting dry. So that is getting from mild to moderate. By the time they are going from moderate to severe, you can see that their eyes could be sunken. You can see that the anterior fontanelle will be depressed and all that. When you do what we call skin toggle, we pinch the skin. Normally, when you pinch baby's skin, it should go back straight away like an elastic. But when you pinch the skin of a child who is dehydrated, you will see that they are it doesn't go back so quickly. It takes a longer time to go back. Then sometimes the children will stop making urine. By the time children stop making urine, by the time they are becoming unconscious, we are going into what we call shock. Then now what that child is almost going, and we don't want that to happen. So that's why I say we want you to come to the hospital. We want you to make sure you are rehydrating the child before you even get to the signs of severe dehydration. There are other signs that doctors will look out for, but those are the kinds of signs that a mother will know. Dry lips, dry mouth, as being thirsty, drinking water. So which a child is thirsty, drink water. When a child tells you they are thirsty, they are already dehydrated. So you should give them water. So and then when they stop making urine or they're becoming very drowsy, unconscious, that is severe and that is an emergency at that point. So, but if you are giving, children can take much water. The body has a way of regulating to make sure you don't get dehydrated. That's why children get thirsty. When you get thirsty, they are telling you my body's water is low. But for children who are not able to talk, you make sure you give them drinks. You make sure, and if they are not able to drink, they are vomiting, you need to go to the hospital. People always ask me, what's the first aid for vomiting at home? There is no first aid for vomiting at home. If a child is vomiting, is not able to drink, that child needs to go to the hospital because we need to get fluid into that child through the veins. That's the only option. Or else the child is going to get dehydrated, and if you go too late getting dehydrated, even for us to get the vein, it will be hard. So it's better you go on time. There's no other first aid when a child is vomiting and getting dehydrated. I hope that is helpful. Next question: What can cause water coming out from baby's eyes? I think I've answered that question. Babies can have water coming out from their eyes. Normally, they can cry. But if the child is having, when you are not expecting child to be having water coming from the house and it's happening throughout the whole day, then there may be an infection going on, and that child needs to see a doctor or other form of irritation of the eyes what we call conjunctivitis and all that, you need to see a doctor. Okay, Courtesy Honors is saying, good evening, doctor. My baby is 1 year. She has cold and running nose, and I've been giving her vitamin C, neophylline, steaming her, but not relieving her. What can you do again? You can go to the hospital. That's the next thing to do. But usually, we want to know, is the child is having cold and running nose? Yeah, usually most of them are viral infections. How long has that been going on? Usually they don't go away quickly. It may take up to 2 weeks. Yes. So if you see in another 5 days, another day, all those things you are giving is not treating anything. The virus is going to run its course. So it's going to run its course usually 10 to 14 days. All those vitamin C you are giving is just trying to make the body immune system fight back. We don't recommend cough syrup. We don't recommend all those neophylline. Please stop it. So all you need to do is to just make sure your child is getting rehydrated and all that. Eat well, keep warm. The virus has come in, it's going to run its course before it will stop. If your child is having fever, your child is coughing badly or struggling to breathe or breathing very fast, those are signs that this is not just a virus, it could be a bacterial infection, and that is when you need to go to the hospital, and that is when we may need to give antibiotics. But before then, we don't do anything. We just wait for it to run its course. All right. Iberi Joanna. Good evening, doc. My baby is 13 months. He weighs 10.2. That is fine. I've started feeding him wood food for a while. That is good. But my mom thinks I should match his food. No, you don't have to match his food. If your baby is already able to eat the solids, then why do you have to go back to matching? There's really no need. Just make sure you're cutting the food small into pieces that the child doesn't choke. Don't give every lump of food at that age. And most of them don't know how to cut their food, so it is your responsibility as a mom to cut their food. But they can eat their rice, they can eat their yam, they can eat anything you eat as 1 year, and they don't need to be mashed as long as they are cut into pieces that they can easily handle. So don't go back to matching. Tola Touch Empire, thanks for all you do for us. Thank you, Tola. My 1 year, 7 months old was discharged but refused to eat. She refuses her cereals to normal food. No normal food. I don't understand. Okay, and I guess what you're saying, usually when children are sick, they usually lose their appetite. They lose their appetite from the illness itself. They lose their appetite from the drugs. Most drugs, one of the common side effects is poor appetite. So sometimes if you don't remember side effects of medications and you're asked in the medical exam, you will just say poor appetite. You are likely going to get away with it because almost all drugs will give you nausea, vomiting, poor appetite, and all that. So it is normal for a child not to be eating as much as they used to eat before they get sick. So one of the evidence that the child is actually getting better is that their appetite begins to return. So you don't need to be worried. You just need to be patient and gradually give them. So at this stage, that's the time you give them whatever they like. And for your 1 year, 7 month old should not be on cereal. Or I don't know what kind of cereal you mean, but your 1 year, 7 months should be eating all the food, should be eating everything else you're eating. So, and sometimes they get tired of all these cereal pap and all those things. You need to make sure they eat all the food. But of course, they may not eat as much. But what you need to do is give them small quantity and let them eat it more frequently. In other words, they eat a little bit, but more frequently until their appetite is completely back. There's no need to worry. It's something, but usually in a few days or so, the appetite will be back. All right, Olufumsi, good evening, doctor. When does the umbilical hernia go away? Okay, my 4-month-old baby still has it. Oh, okay. Umbilical hernia can be 35 years, so there's nothing to worry about. Just leave it alone. And most of the doctors are not planning to operate it because we know that it can get smaller by the time your baby is about 5 years old. So your baby is just 4 months. We are not even worried at all. So, but there are times where the doctors may want to operate it, because that's the only other solution. It's either it goes by itself or we operate it. So there are reasons for operation if it's becoming complicated, if it's too big, or if it is giving the child problem, like it's getting what we call obstructed, like it's causing pain, it is not going back. When you press a normal umbilical hernia, it will just go back normal and should be flat. And then when you move your hand, it comes back. When your child coughs, it gets bigger. When it can go back to normal. But When it's becoming painful, it's not going back to normal, it's causing other problems, or it's very, very, very big, and like almost the whole intestine is inside and all that, then usually the surgeons will operate. It's a very simple procedure. They just go and close the hole, because there's actually a hole that is allowing the things inside the abdomen to come out. That is what we call umbilical hernia. But if it is not bad, we wait for it to close by itself, and there's no need for operation. Just ignore, don't worry yourself about it. It's not something to worry about. All right. Okay. Yeah, Olufumsi, I think I've answered your question about the umbilical hernia. I'm just saying it now. Okay. All right. So Instagram, I've done. I'll go back to Facebook group now and then answer your question. I think I've answered this already. Somebody saying, what causes inflammation of the throat in an 8-month-old baby? Is it hereditary? I also had it while growing up. What do you mean by inflammation of the throat? I always prefer you tell me in your own language, in a simple language, what exactly is you are trying to say without using medical jargons, because you have not told me anything by saying inflammation of the throat. So what exactly in the throat is inflamed? Is the child having tonsillitis? Is it the adenoids? There are so many things in the throat. So I don't know what it is you are talking about. So because of that, I don't know whether it's hereditary or not. Of course, there are conditions that can happen in families. There's a condition that just happen because it's common. It's just like saying it's malaria hereditary. No, because you're born in Nigeria, you are living in Nigeria, you have malaria. So it doesn't have to be hereditary. You will have malaria, your children will have malaria. So that is how common it is. So you may want to ask this question again and be very specific. What did your doctor tell you is actually the diagnosis? Is it tonsillitis? Is it adenoids? What exactly is inflamed? So that we know what we are really referring to. All right. Sometimes your answers to some question are a bit rude. Well, that is your opinion. I deliberately answer question the way I think best. I want to answer question. Just feel free. And it's okay for you not to agree with my answer to your questions. And I deliberately also try to answer questions in a way to draw out some important things. I know some people don't like that, but you really need to know that it's a deliberate attempt, because some parents do things in a way, and if you don't draw out some of those issues, people will not know that what they're doing is wrong. So you really need to emphasize on those issues. But like I said, you are entitled to your opinion. Divine Temple, she's Ram Nweke. My toddler had a 3rd-degree hot water burns at 6 months, leaving its middle right finger bent. Wow. He uses it well, but will it threaten with time? Wow, that's a very serious one. So you really need to see the bones and plastic surgeons. They should, I don't know whether you saw them when your baby had the bones. Ideally, when your baby has bones, there are bones involving certain areas that you really need to see a doctor for. If a bones involving the hands, the legs, the face, the genital areas, you need to see a pediatrician for it or a doctor for it. It doesn't matter whether it's a small or not, because those areas are complications of such burns can be very they can affect somebody for a long time. So for this baby, you really need to see a plastic surgeon. They can do another operation. That's the honest truth. They can do another operation to relieve what I think you are describing is what we call a contracture. If your baby has a contracture, there are operation that can be done to release it, and the earlier the better, because you really want to be sure that and is functional, because these are part of the body that your child is going to use growing up, going to school, writing. So you should see a bones and plastic surgeon if you have never seen them. You didn't tell us how old your child is right now. Okay, but you said your child is a toddler, so we expect between 1 to 3 years old, but I think you should see them so that they can decide. Sometimes they may not even need to do an operation. They may just need to do some other, like occupational therapy, physiotherapy. There are other ways, but we need to make sure that that finger does not become permanently deformed. So the earlier, the better. I hope that is helpful. Yeah, and the next question, Facebook user, can too much reflux affect baby's weight? If it's a child have a very severe reflux, yes, it can. But I don't want to jump to conclusion that it's reflux that is affecting the child's weight. So it is best if you go and see a doctor first. If your child is losing weight, if a baby is losing weight, because you didn't tell us the age of this baby, if a child is losing weight, you really need to go and see a pediatrician, because there are questions we ask you. Don't make assumptions, because parents make a lot of assumptions. You make assumptions about, oh, is it reflux? It may not be the reflux. Just like some people make assumption, oh, is the anterior fontanelle, is the orca? No, it's not the orca. There are many reasons why a baby may not begin with. A baby may have a hole in the heart. A baby may have other congenital things. And sometimes people don't go to the hospital on time, and by the time you show up, it's too late. So any child who is not gaining weight and you're sure you are feeding properly, you should see a doctor first. Don't make assumptions as to the cause of that child losing weight, because you may be wrong. And so it's better you see a doctor, because when you see a pediatrician, they will ask you several questions, and those questions will help us to pinpoint what is. Sometimes we ourselves, we are not sure. Sometimes we need to do tests, we need to do so many things before we can arrive. Of course, we think of common things first. Oh, is it the food? Is, but once you rule out the food, the child is getting enough milk and all that, and the child is losing weight, then we need to be sure. And if a reflux is severe enough to make a child lose weight, that reflux has to be treated. So most time we don't treat reflux with drugs or anything. But if a child is losing weight because of reflux, then it's a reflux that requires what we call a reflux disorder. It is not just simple reflux that baby usually have. That is now what we call a reflux disorder that requires further treatment. So you really need to see a pediatrician for that. Okay, my baby of 3 months often scratches her eyes. Okay, I think I've answered this question. Okay, please ask your question once. Don't ask this again. I'm not going to jump your question. Every question that shows up on my screen, I'm going to answer them. So there's no need to repeat it. And please be patient, because we're going to answer the question and all that, and then I'm going to jump from Facebook. I'll go to Instagram. And if you miss out your question, maybe you were not around, you can always watch the video again and you will see the answer to your question. All right. Another Facebook user is saying, please, my son 3 months old doesn't answer in class. The teacher complained that she doesn't participate in class. She doesn't answer when asked, but at home she sings her ABC song and communicates with me. Is that something to worry about? Yes, I will worry about it. Because sometimes parents say, oh, my child is communicating with me and all that. Actually, the child is not communicating with you, but you make a lot of you preempt the child a lot. You already know what your child wants, so you tend to do it with them, and you don't tend to see the difference, because you already know what your child wants, or you just say, oh, do you want this? You want biscuit, you're already giving the child the biscuit. You have not even allowed the child to say the word. So it is better, and sometimes it is when the children go to school or other professionals see the children that they see the difference. And usually the school is actually one of those places where they tend to pick up children who are having difficulties. So if a teacher is worried about your child, I will be worried as a pediatrician, because the child is in school for, I don't know, maybe 6 hours, 8 hours a day. The teacher sees that child a lot. I don't know whether is the child talking or not able to talk. There are two different. It's either the child doesn't talk at all, or the child is able to talk but does not want to talk in the class, maybe because she's scared of anything or anything. So, but it is better to see a specialist and get your child assessed first, and let us say, oh, there's no problem. Okay, this is what we advise the teacher to do. Than to assume everything is fine and then it is late. Because when children are below the age of 5, that is the best time for us to deal with some of these developmental problems. So it is best to see a speech therapist or a developmental pediatrician for proper assessment. Because trust me, teachers don't raise concerns if they don't have concerns. And when teachers who have tried their own little um they also know about children. They also know that children sometimes don't like to talk in class. So that is part of what they've studied in their education school or whatever. So they know some of those things. So if a teacher has put in some of those strategies about a child who is shy in the class, or a child who is maybe anxious and all that, and they are still worried, then it's best you also get that child professionally evaluated so that we don't have any issues. All right, let's move on. Good evening. My baby is 4 weeks, 11 pounds. Okay, I don't. We're both on breast and formula feeding, was born at 7 pounds. What is the symptom of a gassy and fussy baby? Usually, you as a mother, you are the one that will tell us your baby is gassy, your baby is fussy, because you will see the child either passing out a lot of gas, or your child is, when the child is fussy, they're always crying, they don't want to suck, you know. So it's a symptom that mothers tell us. It's actually not what we pediatricians make a diagnosis of. So parents are the ones telling us my baby is making a lot of gas, because it's not a medical diagnosis, and it doesn't really mean any, it doesn't have any particular medical explanation, you know. So our job is to now figure out, why is this child fussy, why is this child gassy? But the symptom of being gassy or being fussy is actually what parents describe. So I actually tell parents, if you are asking that kind of question, then most likely your child doesn't have it, because if your child has it, you will know, because you'll be the one telling, oh, my child is gassy, my child is tummy is full, and when I tap it, it's making a lot of sound, or the child is always passing out a lot of gas. And usually the commonest reason for that is because people, when children are sucking, either they are sucking on bottles, and most of those bottles, a lot of gas or hair trapped inside, or your baby cries a lot before you feed them, so they're sucking a lot of hair, and you know that's there. So we usually say, please try and be sensitive to your baby's cues. Don't wait for them to cry a lot before you feed them and all that. Then we don't recommend formula feeding. We recommend that you exclusively breastfeed your baby. If you are able to breastfeed, you are lactating, where there's really no need for you to do mixed feeding. Just exclusive breastfeed your baby, and that will help. So then baby can have colic. There are many reasons why baby could be fussy, crying, and all that. So it depends. Even they can be fussy for maybe their nappies are wet, you know, those kind of things. So you just need to figure it out what it is. It is not the fussy or the gassy that is the issue, it is what is causing it, and how do we resolve that. And then the other things will more or less just resolve on their own. I hope that helps. All right. Good evening, ma'am. I'm really confused about scabies. I sun dry, hang on my baby's clothes. Or now they told me you have scabies at the hospital, but I read your hospital on scabies, and those places the rashes are in there. So it depends on who is making diagnosis of scabies. So I can't say whether they are right or wrong, because I've not seen your child. So if you doubt the diagnosis, you know, I mean, if you read about scabies online, you look at the pictures online, you should be able to know how it looks. It tends to affect the spaces in between the hands, especially, and all that. You didn't tell us the age of your child. It's always important to include the age of your child in every question as well. So, but you can always go for a second opinion with another pediatrician if you are not convinced whether, because some people they make diagnosis based on assumption. Okay, because this is a rash around the hands, then oh, it must be scabies. No, without even really taking their time to, because there can be other rashes that can happen around that area, and it won't be scabies. So it depends on who the person who is telling you scabies is. Depends on the experience of the person, or how qualified the person is. Is he a doctor, or is he somebody, another health professional? You know, so if you are not convinced your baby has scabies, then you should see another professional. Go for a second opinion, preferably with a pediatrician this time around, or a dermatologist. Those are the experts. They can be able to advise you further. So, but like I said, without us seeing rashes, we cannot be able to tell you whether it's right or wrong. Next person say Caroline. Good evening, ma'am. Please, my baby of almost 5 months is not sucking well like before since 3 days now. Sometimes we just be looking at me, but it takes more when I express it, but the milk supply is low as it's not sucking directly. It's just recovering from illness. I'm thinking of giving formula. Okay, so I've already answered this question already, that when children are ill and they are just recovering, they tend to lose a little bit of their appetite, either from the medication you are giving, or from the or the illness itself can make them to have poor appetite. So it's not, it's just usually a few, it's something that just lasts for a few days and it will resolve. So I will not recommend you jump to formula because of that. It doesn't mean your child is going to take the formula as well. So you should just keep breastfeeding the baby and try and still breastfeed the child the more, because obviously sucking on the breast is more work than sucking on a bottle. So most mothers don't understand that. So if you do bottle feeding, which is one of the reasons we also don't recommend bottle feeding, apart from the germs and infections and all that, it is easier for a baby to suck on the bottle because the milk rushes out. It's just most, especially most of you make the mouth of the teeth very big, so the milk is rushing out. Whereas the baby who is sucking on the breast is actually doing work, to suck out the breast milk. It's not like that of the bottle. So sometimes babies will prefer bottle feeding because they don't do as much work compared to when they are breastfeeding directly. So, but that does not mean they should not breastfeed directly. So it's best you try and just put your baby to the breast. Usually when children are hungry, they will suck on the breast and they will get better. Because you don't want to inadvertently wean your child. Because if you keep on doing more of bottle feeding, then eventually your child will actually stop breastfeeding, and your baby is just 5 months old. You want your baby to breastfeed for at least 2 years. So if you start doing that, then some of you now say, "Oh, my baby has stopped breastfeeding at 5 months, at 6 months." These are how it started. People start giving bottle feeding, giving formula feeding, less of breastfeeding. And then after a while, the child wonders, why do I need to suck on the breast and put more energy when I can get other things that those require? I mean, I can just be passive and they make will flow into my mouth. So then the child doesn't want to suck anymore. So I would say don't give formula, and I would say don't bottle feed. I would say just keep encouraging your baby to suck on the breast and be patient because your baby is recovering from an illness. So definitely is one of the reasons why the child may not have as much appetite. And also make sure that you are not giving water, any of those things, because usually babies on exclusive breastfeeding should not really be falling sick. So be very careful. But these days I usually don't take parents' words for it when they say they are doing exclusive breastfeeding, because people ask me all the time that they are doing exclusive breastfeeding, but they're also giving water, which means my understanding of exclusive breastfeeding and understanding of some parents, mothers' exclusive breastfeeding, they are completely opposite. So I always want to clarify that this exclusive breastfeeding is with water, without water, because what we want is without water, just the breast milk only. And of course, you're also making sure you are taking care of the hygiene, not exposing your baby to people, to germs and hand washing and all that. So it's not just enough to say I'm exclusive breastfeeding you, but also make sure you are taking care of all those other things so that the baby will not be exposed to having any illness and all that. So I hope that is helpful. Okay. Is it the same Mercy? Okay, Mercy. I try and keep your question in one box. Okay, so you are the one asking about scabies or no scabies. Okay. Are you having serious fever for 3 days? It's an injection for 3 days. Ibuprofen. Yes, it keeps running up. Obviously, your child is ill, and I'm not sure scabies is what is giving this child fever. Scabies does not give children that kind of high fever. I believe your child is in the hospital, I believe. So if your child is in the hospital, okay, your baby is 13 months old, 5 days, and it's on 12 kilos. So if your child is in the hospital and it's on treatment, if the child is not better, then they can refer the child to the next level hospital, either a secondary or tertiary level hospital. But obviously your child is ill, and I believe your child is in the hospital. Hopefully, I didn't say that, but if your child is on injection, what is being treated, those are the kind of questions we need to ask. I didn't know whether you've done blood tests and all that. So you really need to speak to the doctors who are treating your child. But obviously this fever is not the scabies. So this child is ill from other reasons. And the doctor saying your child should be able to advise you what exactly is wrong with your child, what exactly they are treating. All right. Okay. I think I've answered Caroline's question. Good evening, man. Thank you a lot for the work. Please, my baby of 3 months is greenish for almost 1 week. What should I do? Base weight is 3.5, current weight is 6.0. How are you feeding your baby? Your baby on breast milk or your baby on formula feeding? The greenish stool, is it watery or is it solid? You need to answer those questions, then I'll be able to advise further. So I will advise that you post your question again and then we can answer that. But I think our time is up. So I'll just say generally greenish stool is common in babies who are not getting enough milk, but I guess your baby is getting enough milk. But if you're formula feeding, formula feeding can also make your baby to have greenish stool, or if you are taking products or things that can stain the stool green. So those are the information we need to know to be sure. All right. My baby of 3 months old suck for just 5 minutes. I know she doesn't suck well because her diaper is always dry. Mm. Even when I express she refuses to suck from the bottle, I feel her weight is going down. As she added just 5 grams in the last check. Should I force feed? No. I mean, do you expect me to tell you to force feed your child? I will never do that. So there's even no need to ask that question about should I force feed. Please, nobody should ever force feed a child. I mean, people have literally killed children by force feeding. I mean, I'm not exaggerating. I've seen it. I've seen such children. If you are doubting me, I think a grandmother in the US, 70-year-old, was sentenced to 15 years in jail because she force fed the baby and the child died. So no mother should ever force feed a child. If you doubt, you can go and Google that information. So it is really that serious. Don't all this method they say, oh, let's just open the mouth and children can die from it. It's really that bad. So please do not ever force feed your child. If your child is not eating, the question is why. So you really need to go and see a pediatrician. If your child, I worry about diaper being dry. If your diaper is dry, your baby is also not making urine. Is there an health issues going on here? So I think it's better. I'm not really worried about the weight of your child for now, but I worry about the dry diaper. You need to. What I normally do is what I normally advise is take off the diaper completely, feed your child and see whether the child makes urine. Don't worry about the mess. We just have to be sure because some of those diapers are so hyper dry that you will never know because they are still looking so dry because that's what they are trying to sell to you. So, but if you take off the diaper, feed your baby within 30 minutes, 1 hour, a child will make urine after being fed. So you need to check. But your child is not getting enough water, enough fluid. I mean, from the breast milk, then your child will not make enough urine, and that worries us. So this is a case for us to see a pediatrician because some children are also not feeding well because of other health issues. For example, children with congenital problems, children with heart diseases and all that, they won't suck well. They get tired when they're sucking, so they don't suck for long. So these are sometimes the first signs we pick up that there's something else going on. So it is not just enough to be force feeding or going for formula. It's about why is the child not feeding well? Why is the child not gaining weight? Why is the child not making urine? That is what we are always trying to answer. That is if you don't know the why, just force feeding or doing that will not solve the underlying why and may even cause more trouble. So please do not force feed your child. See a pediatrician and let them see whether they can figure out why your child is not feeding well. Okay, my baby is 2 years old, love Quaker Oats, eats other food. Is it okay to give her Quaker Oats every morning? She takes other sorts of food. It's okay if she wants to eat it. That's fine, as long as she eats other food according to you. Lorena, you say, thank you, doctor. So please don't drop any more questions because it's already 7 p.m., but I'll try and answer all the questions that have come in before 7 p.m. If your question comes in after 7 p.m., I will not answer it, so don't get upset about that. But you can always post your question directly on our Facebook group from Monday to Saturday, and I will answer them. Okay, back to Lorena. My baby is 1 year, 9 months. At what point would I stop seeing any sign of the front? Okay, do you mean when does the anterior fontanelle close? Usually closes by 2 years. Okay, there's no reason for you to worry about it. Just don't bother yourself about the anterior fontanelle. Just leave it alone. It doesn't disturb the baby. Just leave it alone. It's just a space. But usually it closes by 2 years. My baby is 5 months, all stones, has all stones, roll from side to side, but can't roll from tummy to back. That's not a problem. Usually that's around 6 months, so I'm not worried about that. So don't force the baby. So usually when we say your baby should roll around 5 to 6 months, it's a range. Some people will do a little bit earlier, some people will do a little bit later, but they are still fine. But you don't have to force the child to achieve those milestones. They will do it by themselves. So leave the child alone. Your child is fine. H&M, can I have vaccine on my baby's navel or pour water on it so that the navel will come out? I don't understand. I guess you are confused. Someone told me that the navel will not become big so that the navel will not become big. Okay, okay. All right. All those is just nonsense. What the person told you is nonsense. They are myths. You're pouring water or not pouring water, you're putting vaccine or not putting vaccine does not make your baby's navel big or not big. It has nothing to do with that. So just leave your baby's navel alone. Just bath it normally, and that's it. You don't need to do anything about it. What can I use to reduce my baby's pain from immunization? You can give paracetamol, but give age appropriate paracetamol. So you need to ask your doctors what dose of paracetamol you used to give. Most of you just go home and give your baby some 0.3 or 0.6. Some of those drops are really not age appropriate. They are too small for the child's birth weight. So when you go for immunization, ask them how much of paracetamol should I give this baby, so that they will tell you depending on the weight of your baby, because you have not told us that. So I can't give you specific. If you have told me the age and the weight of your baby, I would have given you that answer. Oluwatosin say my baby is not eating well, still breastfeeding on demand. I don't give milk. Is it okay? How old is your baby, Oluwatosin? You have to tell me the age of your baby. It's very important. Solomon Waffle, do I give my baby Colival? It's not necessary, though you didn't even tell us the age of your baby. And it's very important for you to tell me the age of your baby when you're asking question. Okay, I think this is a repeat question I've answered already. I observed my sister's baby have flat face in one of the fades. Any solution to it? I would rather you let a doctor or a physiotherapist see the child. Let us first. Usually, most babies, you didn't tell us the age of your sister's baby again. Most babies below the age of 1 year actually have flat feet. So if you have to tell us the age of the child, then we can situate the question. But let a professional do the assessment as well. Can salt and sugar be added to baby's food post 1 year? Yes, you can add it. Just make sure you use a little at a time. Don't overload the baby's food with salt. Don't overload it with sugar. Uh, Juliet, happy. I noticed my baby is always tapping her ears and her head when crying. Should I be worried? She's 1 year. If she's not doing it when she's not crying, it may just be an habit thing. I will not worry about it. But if she's always doing it repetitively, I will worry about it. So it depends on how frequently it happens. If it's something that happens just once in a while, I will not worry. But if it's something that happens all the time, I will definitely worry about any repetitive behavior. Okay, Lawal is saying my infant was born 33 weeks, birth weight was 1.8, exclusive breastfed, 6 kilo at 6 months. She weighs 6.4 at 7 months. Is he okay? So your baby was born like 7 weeks earlier. So at 7 months, your baby is actually like about uh we'll say about 5 months, 3 weeks. So 6.5 is okay at that age. She can't sit independently. Yeah, so you need to understand that your baby is a preterm baby. So when we are looking at your babies for developmental milestone, we are not going to look at your baby as a 7 month old. Your baby is actually like a 5 month old. So this is the difference. So we have to correct your baby's age. We need to deduct the weeks that your baby was born earlier. So even when your baby is 7 months old, so when we look at development, when we look at weight, which is exactly what I just did now, we are going to be looking at that baby like a 5 month old, not a 7 month old. And usually we are not worried if a 5 month old is not yet sitting independently, because sitting independently is actually a 7 to 8 month old milestone. So your baby is actually not 7 months old in terms of the corrected age. Your baby is 7 months old by the chronological age, but your baby's corrected age is actually about 5 months, maybe 1 week. So you really need to understand that it will save you a lot of stress if you have a preterm baby. Your preterm baby is not assessed like a baby that was born at 40 weeks. We assess them knowing that they were born too early. So we always correct their age. We always subtract from it. Okay, the question is she can't finish one boiled egg. It's not compulsory for her to finish one boiled egg. She can only take little complementary feeding while finding. I'm not sure I understand the last part, but for more information on complementary feeding, I would advise that you go through our guide 2 section, and you have to also be knowing that when it comes to complementary feeding, you need to know what is the quantity for a child. So your baby is actually your baby ideally is just about to start complementary feeding. So I don't expect that 5 months, 1 week to even be finishing one egg or to be taking one egg, because really that's a lot. So you really need to understand how to to do things, how to work out, what is the appropriate quantity of food for that age, so that you don't set up your child for failure because you are putting unnecessary expectation on the child. The child is actually doing what the child should be doing, but because you have the wrong expectation, then you get upset because you think your child is not doing what the child should be doing, whereas it's just the wrong expectation. So I would say just go back, do the complementary feeding course, know what is the quantity the baby should be taking at 5 months, at 6 months, and then you can work it out from there so you can relax. And I hope you're still breastfeeding as well. So your baby should still be breastfeeding more even now that you are starting complementary feeding. I gave birth to my baby with a blood stain on one of her eyes, and it's still there. What should I do? Nothing. You don't need to do anything. Just maybe it is going to go by itself. Usually, the blood is from the blood that comes out, during the delivery. Sometimes it enter into the eyes. It will clear by itself. You don't need to do anything. Okay, what are the signs of measles to watch out for in children that's already taken measles? The signs of measles is the same for children who didn't take measles. It is a very unlikely thing for a child who has taken measles immunization to have measles. So I shouldn't expect your child who is immunized to have measles. And measles is not just skin rashes, because sometimes I wonder whether mothers just use the word measles for rashes, because there are many rashes that are not measles. And I was just telling one of the mothers on our Facebook group, because experienced mothers have told her that her child has measles at 5 months old. So some mothers just see your child have rashes and they say it's measles. It is not. So don't take diagnosis from experienced mothers. Only a doctor should give you a diagnosis of measles. So the same children who have measles are going to have fever, they may have cough, they may have catarrh, they may have conjunctivitis, red eyes, and then later on have rashes. And the rashes usually start from the what we call the hairline, and then go down the face and go down the rest of the body. And there's a typical way the rashes of measles look. But measles is usually preceded by fever, it's usually preceded by the cough, the catarrh, and the red eyes. So if your child does not have the 3 C's and your child does not have fever, your child does not have measles. So most mothers are always making measles diagnosis just because the child has rashes. No, there are rashes that may look like measles rashes, but they are not measles. So don't make measles diagnosis yourself as a mother. Don't. If you suspect it, it's fine. Then go to see a doctor and let the doctor be the one to confirm it, or to say your child has measles. Don't do it by yourself, please, so that we don't create unnecessary issues. So Oluwatosin say my baby is eating well, still breastfeeding on demand. I don't give milk. You say, okay, your baby is 19 months. So as long as you're breastfeeding, you don't need to give milk. But when you stop breastfeeding, you can give other milk, because your baby will still need milk to the age of 5. My daughter is having rashes. That is Fabian, with pus inside on her back. What can I use to clear? You need to see a doctor. Your child is having rashes that have pus. That is infection. Most likely bacteria. Your child will need antibiotics that need to be prescribed by a doctor. Please don't self-medicate. How do you know if breastfeeding is enough? Okay, so we have a lot of breastfeeding videos. We have one video that actually answered this question on how do I know my baby is getting enough milk. I will recommend that you watch that video. Or if you put this question on our Facebook group, we can also share all this information with you. Okay, so that is it. But the most objective way of knowing your baby is getting enough milk is that your baby is gaining weight. That is the most objective evidence. But there are other signs that you can also use. So I think I've answered that question. Should I give my baby gripe water? No. Should I give my baby nospermine? No, not recommended. Just breastfeed your baby only. If you think your baby has colic, you can give Infacol. Otherwise, nothing else is recommended. Okay. Alimi say my baby is 4 years and recurring malaria. Treated her like 4 times this year alone. You need to see a doctor. Be sure that what your baby actually has is malaria. Then, are you living in a mosquito infested area? Is your baby sleeping under mosquito treated nets and all that? You need to make sure you are doing the right thing first. So make sure your child is sleeping under mosquito treated nets. Sorry, insecticide treated net, and your child, you fleet your house, make sure you clear all the bushes around your house, you get rid of mosquitoes basically, and then do that. So if your child keeps on having malaria, every fever is not malaria, so you really need to be sure what your child is having is malaria and not something else, because every fever in Nigeria is treated as malaria, and that is not true. There are like 101 causes of fever. You need to see a doctor and know what is causing the fever. It's better you even see a pediatrician, because your child should not be having malaria 4 times in 1 year. uh Especially if you are not exposed to to mosquitoes every time. Tonya is saying my baby was born preterm, 33 weeks. Okay, that's another preterm, 2.1 kilo. Don't miss feeding. Do I give water, please? What do you, if you are giving formula, you give water. We recommend that you breastfeed your babies. Actually, preterm babies, it's best you don't give them formula, because they're actually their own intestines are actually not even as mature like the term babies. So it is best you don't give them, and you can exclusively breastfeed your preterm babies. I clean him with baby face towel and soap, but not every day, especially on cold days. Am I on track? That's fine. Um, when can we go for circumcision? You can go for circumcision anytime you want. Your baby is 2 kilos. So you didn't tell us how old your baby is now. So we don't know how old this baby we're talking about is, but it's okay. You can go for circumcision as long as your doctor is happy to circumcise your baby. There's no problem about it. Good evening, ma. What's your opinion on inla? Okay, so inla is another word used by people for some kind of rashes. So, like I said, all these native diagnoses, they are not they don't always have the same meaning in medical jargons. Let me put it that way. So if you think your baby has something and somebody is telling you this, it's better you see a doctor and let us tell you what exactly your baby is having. And what I found out that people will use the same inla for conditions that are actually different. They're not the same all the time. So we really prefer to see the child and make our own diagnosis and not assume. And please don't give your children any herbal products. Don't go for any scarification mark. You're going to introduce what's it called? You're going to introduce tetanus into them and all that. So just let a doctor see your child and give you appropriate treatment. Okay, my 10-month-old doesn't take milk except breast milk. That's fine. She purges after taking milk. So that means she may have some, maybe some intolerance to maybe cow milk, protein, and things like that. So give breast milk. You don't need to give other milk. If your 10-month-old is breastfeeding, they don't need to take any other milk. And she's sitting currently and running temperature. Your baby running temperature is not sitting. Your baby is sick. You should take that baby to the hospital, give paracetamol, and take the baby to the hospital. Please don't always assume a child who is sick is teething. That is one of the most dangerous assumptions mothers make all the time. And then you go to the hospital, the child is very ill, and we're like, why didn't you come yesterday? Why didn't you come 2 days ago? Oh, I think it's teething, and I'm giving teething medication. Please don't assume teething. Teething does not make your child to have fever. Teething does not make your child to be sick. A child who is sick should be taken to the hospital, see a doctor, whether it's malaria, whether it's another infection, let it be treated. That is a very dangerous assumption to say your child is teething. That's why your child is having fever. And don't give any teething drugs at all. I hope that is helpful. My baby has swelling in its pubic region. They said it's undescended testes. You need to see a doctor if your baby has undescended testes, because your child has to be operated in the next few months. Your child must be operated before the age of 1 year. If a child has undescended testes, the child must be operated. The testes must be brought down into the scrotum, or else the testes will be permanently damaged, and that is the end. So if it's on one side, it's okay, but if it's on both sides, it's even worse. So undescended testes must be treated before the child clocks 1 year. It must be brought down. I've seen mothers come to me 7 years, 10 years old boys, and the testes were never or the cell tests were never corrected. That testis is gone. And you know the implication for that for a male child. So please, undescended testis must be operated. I hope it's undescended testis or not, because it could also be hernia, because this your information, I'm not really sure. Did they do a scan and say what is swollen is the testis? So you need to be sure. Are your boys are the balls? Can you feel the balls in the scrotum? Because I would really recommend you see a pediatrician preferably, so that they tell you what to do. And no, because what a swelling that is coming and going sound more like an hernia rather than an undescended test. But then I don't know, maybe it is your own description, but you really need to, if it's undescended testis, it must be operated. There's no solution to it. It must be brought down before your baby clocks 1 year. But if it is anemia, it can also be operated as well. 2 years is running fever, mostly at night, having catarrh and cough. What do I give him? You need to take him to the hospital so that he can be treated. You can give him paracetamol, but you need to know why is the child having fever. But if he's having cough and catarrh with the fever, sounds like a respiratory infection, but it's best to get a doctor to treat him. The only first thing you can give is just paracetamol. Is it true that a child will outgrow recurring boils? Why is the child having recurring boils? It is not normal to be having recurring boils. So you really need to see a doctor to know why your child is having recurring boils. Is there something wrong with the immune system? Why? Or is it the hygiene? What is the issue? But having recurring boils is not normal, it's wrong, and we should know why and sort it out first. Okay, I guess it's the last question that came in before 7. Good evening. My 2-year-old is still sucking breast, and I've tried to stop him, but to no avail. Okay. People are telling me to stop by all means because it's going to affect his brain. That is not true. Your baby is actually getting better by sucking than not. So the other way is actually correct. So you can breastfeed your baby as long as you want. We say 2 years and beyond. So it's okay for you if you want to breastfeed your baby beyond 2 years. You don't need to worry. It's not affecting the baby's brain. Rather, the baby's brain is actually getting better by breast milk. So don't listen to what people are telling you. But if you want to stop your baby's, if you are, looks to me like you are not psychologically ready to stop breastfeeding your baby, because there's something like I want to stop and you can't stop him all to no avail. That is a mother who is not yet ready to stop breastfeeding. Trust me, if you are ready to stop breastfeeding, you will stop, and that's it. But you are emotionally not ready, because obviously when you stop and your baby cries, then you're giving the baby the breast. But once you make up your mind, you're ready to stop, you stop. When your baby cries, you find other ways to calm the baby. In the next 2-3 days, the child will forget about the breastfeeding. But if you are also being not emotionally ready yourself, it's okay to keep breastfeeding, honestly. But I don't think I don't agree that you try to stop breastfeeding and you can't stop. I mean, that is really not say that just shows that you are not ready to stop. But it's okay, which is fine. Okay, somebody's asking, is breast milk enough for a toddler who react to both baby milk and adult milk? When the baby reacts to milk, the baby is reacting to a particular thing in that milk. You see the cow milk protein and all that. There are other alternatives. So you need to see a pediatrician. They'll give you an alternative milk for that child. Good evening, Patricia. My baby is 2 months. Sleep longer when facing down. No, no, no. Your baby should never sleep facing down. Your baby must always sleep on the back, because we are talking about sudden infant death syndrome. So please, it is what you teach your baby that your baby knows. Your baby does not know the difference between sleeping on the back, sleeping in the front. Because you're putting the baby on the front, you think it's better, but that is joking with SIDS, and trust me, it's not worth it. So please put your baby on the back to sleep all the time. Then the baby gets used to it, and baby will always sleep on the back. No facing down to sleep. The baby can die from it. It's that dangerous. So you don't want to try something like that. You block the nose, and that's it. So please put your baby on the back to sleep all the time. Breastfeeding, your baby is 5 months old, you want to introduce her to fruit and vegetables? No, no, no. You should try that at 6 months, not at 5 months. What causes reflux? You've asked this question. I've answered the question. I asked you to rephrase. What exactly is the inflammation in the throat? What part of the throat is inflamed, so that we know how to address that. Adraku is saying my baby is born at 3 kg, 6 with 4.8 to 5.5, 10 with 5.5. It's not getting weight in the last 2 weeks. How are you feeding the baby? That's the most important information I need to know. Your baby should be sucking and not sucking the finger, should be sucking the breast milk. Are you exclusive breastfeeding? You didn't tell us that. The information we need to know for that baby is a baby whose weight is static, is why is baby not getting weight? How is the baby being fed? Is baby being fed enough milk? Those are the questions we want to know. Complimentary feeding guide, just post this question on our Facebook group. One of our moderators will show you where it is. You need to be on a full Facebook app to see the guide section. If you are using Facebook Lights, you won't see it. So you have to use the full Facebook app. Doctor, what? Please, can I use treat a mosquito net for by 3 months old baby? Yes, you can even use it for your newborn baby. Should I be bothered about mosquito bites causing malaria? Yes, of course, you should be bothered about mosquito bites, but that does not mean you should treat mosquito bites, but you should keep your baby on. You should make sure your baby does not keep getting mosquito bites, because if your baby gets mosquito bites, one day your baby will get the bites that will cause malaria, fever, and all that. All right, thank you. I finished answer all the questions on Facebook. Finally, finish on Instagram. Uh, Let me just know where I stop on Instagram. Okay, I don't know where I stop. Okay, I've asked Olufumi question. Yes. Okay. Demi say, what is medical term used for baby that are sick? We call it hypertonia. Hypertonia, increased tone. Yeah, that's the medical jargon. But don't worry about the medical jargon. So don't worry about that. My 7 weeks old baby grunts a lot when she wants to pull and release gas. That is normal. There's nothing wrong with that. All babies do that grunting sounds, and does not mean they are struggling. It is just a sound. So don't panic about it. Also, she has spasm on her legs. What do you mean by spasm? Do you mean she shakes her leg when she's sleeping? So it's okay for babies to shake their leg when they are sleeping and all that. But if she's shaking her leg when she's awake and you try to stop it, you can't stop it. You need to see a pediatrician, because the child may be having seizures or convulsion. That's the way we call it. Can a 9-month-old take biscuits, Bribida? No. This is how we start all this junk feeding. Then we will not say your baby doesn't want to eat food. Your baby only wants to eat biscuits and Ribena and tea. We mothers start it all the time, and I always tell us, please don't introduce your babies to junk food, and then later you will not be struggling to get them to stop. Give them healthy snacks. Fruits are healthy snacks. Other things, they are healthy snacks, but not biscuits, not Ribena, not all those junk juices and everything. Give them banana, give them oranges, give them, you can call apple, you can make smoothies, you can make smoothie. Do those ones. They are better options, because to start this junk food, it's become hard to stop. Star, okay. Is it safe for a pregnant woman to go for chest x-ray? Oh, no, it's ideally not. Ideally, you shouldn't. If it is not like emergency x-ray, like your life depends on it, you shouldn't do an x-ray when you're pregnant in the first trimester. I would say no. And I'm sure your doctors know that. So tell them you're pregnant and you'll be exempted from doing the x-ray. If it's just for travel purpose, they will exempt you from doing the x-ray, because you are putting your baby at risk of radiation, and it's dangerous. So we can do x-ray in a pregnant woman only if we are trying to save the life of that pregnant woman, not because you want to travel. That's not enough reason for somebody to go and do an x-ray in the first trimester of pregnancy. Although my baby cannot sleep on his own except it's on my breast. Okay, it's an habit that you started. You need to stop it. How old is your baby? You didn't tell us the age of the baby, so it's hard. Yeah, but you need to stop the habit, because I'm telling you, it's not going to stop unless you do it. So you don't let your babies use crying to manipulate you. If your baby has already slept, you put them you put the baby on the crib or the baby's bed. The baby cries, you don't have to carry the baby again. You can still rock your baby on the bed and let the baby fall back asleep on their own. But if you keep putting them on the breast, you see, they will always get used to that, and it's becoming harder and harder for you to stop. So I always tell mother, you don't need to be panicking because your baby cry. It's okay for babies to cry. There's not everything is about once they cry, everything must be they must not cry. No, it's okay for them to cry. There's nothing wrong with crying. It's the only communication they have at that age. But then you begin to teach them this is what is going to happen. So if you cry but you're already being fed, you are not wet, there's nothing, you don't need to carry the baby all the time. You can rock them and the baby will fall back asleep on their home bed, and they get used to it. And then baby doesn't always have to lie on you. What happens when you are not around? Then the baby is still going to sleep anyway. So it's better you get used to it, or else you'll be stressed yourself, and it's not good for you. I hope that helps. Omolara, can I give my 9-month-old coliver oil to prevent cough and catarrh? No, coliver oil does not prevent cough and catarrh, and there's really no need to give it. Child Lucy, we went for immunization last week. They said Penta is not available. Why? Okay. Is it going to affect her? It's at third dose. She's 3 months and 2 weeks. Don't worry, just go back again. I'm sure Penta should be available very soon. It's not one of those vaccines that will be out unavailable for so long. If you can tell me your location, I can find out for you what is happening in your situation. Jewelries, well done. Why should I worry about reflux? When should I? You shouldn't worry about reflux. But if your baby is having reflux and your baby is not gaining weight, then maybe you should worry. Maybe you should see a pediatrician. I will not say worry. Maybe you should see a pediatrician. But if your baby is having a little reflux, your baby is gaining weight, your baby is otherwise well, there's really no need for you to worry. My baby is weighs 2.6 and 4.5 at 6 weeks. That's good. It's on EBF. It speaks mixed every time. There's no need for you to worry because your baby is obviously gaining weight well, so there's no need for you to worry. Can I please my baby say she's almost 6 months old? You can. Just make sure you don't make it tight. Soft ruffles is enough, please. Ruthie is saying, good evening. My 11 weeks old baby cries sometimes when he's sucking. I hear his stomach make sound when he passes gas. Recently, I feel it's preventing him from sucking well. No, there's no need to worry. Babies do that all the time. They are very sensitive to the gas or everything passing through their tummy and all that. So it's not something to worry about. It's something they outgrow. Don't do anything about that. Udo, maybe it's 2 months, so we cannot. Okay, your baby that cannot sleep. Okay, yeah, it's 2 months. So thank you for telling me. Yeah, you need to start getting baby to sleep on their own. Don't worry. At 2 months old, don't always let them. Babies like to be on you because they like to feel you. You are their security. You are the food security and all that. So, but you need to just let them get reassured to the fact that you are not running away and that the baby can sleep on their own bed without having to lie on you. So usually most times, best you let your baby fall asleep on their bed. You don't wait for them to sleep before you put them on the bed. So it's always actually better if they fall asleep on their own bed when they are still awake. But you can be next to them and be close by, but you don't always have to always hold them all the time before they will fall asleep. Just try, you see it work. Okay, Moyani, my 7 months is yet to walk on her own. Wow. Okay, usually we say we see us at 18 months, but I think 17 months is close enough. So I would say maybe you should see a pediatrician. She climbs and moves with support. She walks when held, but not on her own. She also does not answer her name. Yeah, I'm really worried about your baby. There are so many things I'm worried about. Yeah, so at this age, I would really want to see a pediatrician. I think your daughter needs a developmental evaluation. Port Harcourt. I will find out what is happening in Port Harcourt. But is anybody else experiencing Penta shortage in their location? Just let me know. But I will find out from doctors in Port Harcourt what is happening to your Penta. But I think it may just be maybe in that particular health center. Why not try another health center or maybe go to University of Port Harcourt Teaching Hospital and find out whether they have the Penta. You don't have to take it in that particular location. You can take it anywhere else is available. So maybe it's about supply, but Penta should never be out of supply because it's immunization maybe takes like every 3 times 6, 10, and 14 weeks. And I've not had anybody else saying they can't get Penta. So I know Rota is not always available, but not Penta. So just check again or check another health center or your general hospital or your teaching hospital. Somebody will have, I'm so sure of that. All right, I think that's the last one. Oh, maybe 6 months on EBA, family friend with a pediatrician gifted us some multivitamin and vitamin drugs. People call it, well, should I give? Well, I would never give a baby drugs. And I don't think it's a good idea to gift baby drugs. I don't know who your pediatrician with a family friend is, but I will leave that up to you. But I would not recommend your baby to take any drugs. That's my own personal recommendation. None of those drugs, but since the person who gives you the drugs is a pediatrician, you can have that conversation with that person. But I would say no, but you can ask the person. Okay, thank you so much, everyone. I think we've had a wonderful evening. We'll see you guys next week, Monday. Just for you to know that by 18th of December, we will go off for our Christmas break. And we'll be back, I think, the second week of January. We'll let you know. But if you have any questions, you can always post your question between Mondays to Saturdays on our Facebook group. We don't do DM question and answer for those on Instagram. please find your way to our Facebook group, because Instagram is not structured for the way we do things. But we can do it on Facebook. But obviously, you can ask your question live on Instagram live. That is the only time you can do Q&A. But Facebook group is available for you from Monday to Saturday. And we also have anonymous option, so you can ask a question without putting your name, so people don't know who you are. For those of you who are worried about your family members, neighbors on the Facebook group, so that they don't know it is you, use the anonymous post option. We also have a lot of guides on all this topic. You can also watch our YouTube channel for all the previous episodes of ATP Live or other topics that we've taken. You can also go to our website, www.askthepediatricians.com, and you can read up on some of the topics that are very important about children health issues. So thank you so much for joining me today, and have a wonderful evening. Bye.